Hello, everyone, and welcome to our EHE Regional Learning Collaborative session on strategies for PrEP engagement and retention. My name is Reyna Hernandez, and I'm the EHE coordinator here at the UCLA Center for HIV Identification, Prevention, and Treatment Services, or CHIP. In the chat, you should have an option to send a message to all panelists and attendees. Please use that option to introduce yourself to everyone with your name, your affiliation, and your location. Today's discussion is covering the critical topic of strategies to engage, support, and retain communities at risk for HIV in PrEP care. When I last checked the EHE dashboard, our overall PrEP coverage rate for California was about 24%. Indicating that we have a long way to go to ensure this critical prevention tool reaches communities in need. We have had a couple of last-minute changes to our agenda today. Manny Morrow, an awesome prevention navigator from Radiant Health Centers, was going to speak this morning on our panel, but unfortunately will be unable to make it. But in good news, we have a fantastic addition to our program, Commander Michelle Sandoval Rosario from PACE. She'll be starting our program off with a few updates on some of the PrEP awareness and engagement efforts our federal partners are working on, and we'll take a few questions for her right after her update. We'll then continue with our panel presentations and spend the last 30 minutes or so on panel discussion and open Q&A. As always, please feel free to submit questions at any time during the session using the Q&A function on your Zoom control panel. We'll also keep the chat open in case you'd like to share any comments or resources with the group, but we'll use that separate Q&A function to collect questions. And we are recording the session, and we'll post the recording and slides on our EHE Regional Response webpage within the next week. So now I'll turn it over to Commander Michelle Sandoval Rosario, Director of PACE Region 9, for an update. Thanks for joining us, Michelle.
Thanks, Elaine, and thanks so much for the invite. It's great to see a lot of familiar virtual names on the Zoom. So the presentation I'm going to give, you all have heard me probably numerous times, but I want to give just a few updates of what we've been doing under the new administration, how excited we are that the focus is really looking at some of these inequalities in HIV. And Elena, you said something really important in the beginning, that we've made progress with PrEP uptake, but we know the progress is not the same across many different communities. So I'm just going to run through my slides. I'm going to probably take about 5 minutes or so just to give high-level updates and then answer any questions. So let's see. No matter how many times we've been doing this for the last year, it's like new every time, right? So bear with me. Okay, I think I did this wrong, but okay, awesome. Can you see my slides?
Yep, your slides are showing. If you want to put them in slideshow view, that would be great.
Okay,
Perfect.
is that better?
Yep, that's great.
Okay, great. So again, thank you for having me. For some of you that might not be aware, my name is Michelle, and I physically sit here in Region 9 in beautiful sunny Los Angeles. So it's great to connect with all of you. So for those of you who are not familiar with the organization that our program is under, I work for the Office of Infectious Disease and HIV and AIDS Policy HIV team, that's a mouthful, which is within the Office of the Assistant Secretary for Health. And as you can see in this screen, there are many different initiatives that we're working at the federal level to support the work that you're all doing to end HIV in the US. And I particularly want to talk about what we're all here for today, right? PrEP. And what does that mean? And what are we doing at the federal level to address some of the inequalities and increase the uptake of PrEP? And that is really an important tool of how we're going to end HIV, right? Before I get started, I think it's important. We all know we are under a new administration. There are a lot of different moving pieces going on, and we're very excited. But one of the things that I wanted to share and use this platform is that the message that we have heard from the Biden and Harris administration has been very clear that ending the HIV epidemic remains a priority for the nation and for his administration. And with that, we're really expecting additional funding for the work that you're doing to be able to continue to accelerate it and straighten the work that you're doing. And some of you, as you might know already, Harold Phillips, who used to be the chief operating officer, my boss, over at the OASH office, was just recently named as a director of the National Policy HIV within the White House. That's very exciting because we know within the Trump administration, that program was really disseminated, right? So now we have an advocate, we have an opportunity to really, again, accelerate and strengthen what we have. Harold knows what are some of the challenges and the barriers. So we're very, very excited. And that's something to think about as we continue to move forward. And when we talk about prevention, specifically when we talk about testing, we know that the only way we're going to get testing in PrEP into the hands of the community is by testing, right? Because essentially it is the gateway to both prevention and to treatment. So I wanted to make sure that all of you really had an understanding that this continues to be a priority. And this is very exciting time because the focus is really going to be looking at not only how do we end HIV, but how do we unpack those inequalities and get to PrEP and PEP and other prevention services to those who have been impacted by HIV for over 40 decades. If you haven't had a chance, I encourage you to go on the EHE dashboard, which is a dashboard that was developed to really be transparent of where we are in ending the HIV epidemic. It's a really cool dashboard. You don't have to be a scientist or an epidemiologist. And I wanted to just give a snapshot of where we are nationally with PrEP, as Elena mentioned. We've done great progress, right? But clearly we can see that there are still disparities across racial and ethnic groups and gender. So if we look on the left-hand side, my left-hand side, actually, let's look at the right-hand side under percentage coverage. This red line here represents the number of the percent of individuals who have initiated PrEP, right? Not on PrEP, because this is just a cross-sectional point in time, but really who had initiated PrEP. And we can clearly see within racial and ethnic groups, there's a disparity. So we see an increase among whites, but we don't see the same distribution across Blacks and African-American, which is the blue line here. And we also don't see it across our Latinx community, which when we look at the epidemic, we know these are communities most impacted. And most importantly, we also see huge disparities among gender. And this is not new to all of us, right? The purple line represents the number of females or the percent of females. And that's very low compared when we see the PrEP uptake percent among males. So again, there is still a lot of work that we need to do. I would encourage you to go on the EHE dashboard under hiv.gov, and you can really see what PrEP and those other areas that we're looking at for EHE, so testing and all that. Go on it, play around it, and you'll be able to see what this looks like specifically for your county. You've heard me talk about Ready, Set, PrEP, and I'll continue to push Ready, Set, PrEP. You know, here in California, and I know we have partners from other states, we're very lucky, right? California is really leading the way in PrEP. Now we have pharmacists who can prescribe PrEP, and the reality is that individuals have access more to a pharmacist than their medical provider, right? We also have the PrEP Assistant program, which provides free PrEP at no cost, but also those other services, STI treatment, vaccination, covers a cost. The Ready, Set, PrEP program works similar to the PrEP Assistant program, where it provides free PrEP to those that qualify. So those that have a negative HIV test, have a valid prescription, and have no prescription coverage. So when I think about who would really qualify under this federal program, I think about those individuals who don't have any type of coverage because of their citizenship status. So I always want to keep pushing Ready, Set, PrEP, because you don't have to be a PrEP provider to get someone enrolled in the program. You could do it within 5 minutes, either over the phone, online, and that individual can pick up their PrEP at one of those participating pharmacies, or now get it mailed directly to their home or to the facility. So again, I feel this program really does help those who are undocumented, perhaps can't get on any type of insurance plan. So in order for us to increase the uptake of PrEP medications and enrollment into Ready, Set, PrEP, we launched what's called I'm Ready. And this is very exciting because this is a campaign that really utilizes real people, real voices, sharing what it means to be on PrEP and how it has empowered them to protect themselves and their loved ones. We know that HIV has no demographics, so it's exciting because this campaign really highlights individuals speaking from communities that are most impacted. So we feature a Black cis woman, a trans woman, an individual from the Native community, from the Black, Latinx, MSM, talking in 30 seconds or less how PrEP has really empowered them. And when we talk about barriers to accessing PrEP, I look at the stigma issues, right? Stigma with going to access, stigma to being on it. So we're hoping that this campaign will help us normalize PrEP for everyone in the community. So I would encourage you to go on hiv.gov and check out the videos, and I'll play one or two depending on time at the end. So we've been doing a lot at the federal government. I talked a little bit about the priorities in the beginning, looking at not only ending the HIV epidemic by increasing PrEP and testing, but most importantly, looking at the inequalities. So within our office, we have what's called a Minority HIV/AIDS Fund, which some of you might be funded under. Within this funding mechanism, we're really focused on working with partners across all levels to really scale up HIV prevention services, right? So not only PrEP, but everything we have in our toolbox. But most importantly, scaling it up in those non-traditional HIV areas, STI clinics, emergency rooms, primary care, federally qualified, because when we talk about these missed opportunities, how do we address them to make people aware of PrEP? So that's something that we've been working with our partners at the federal level through the Minority HIV/AIDS Fund. So in summarize everything, there are many things we can do that all of you are doing, and we'll be hearing from our partners. The number one thing is creating culturally linguistic appropriate services when people are seeking PrEP, seeking to get tested, right? How do we create patient-centered, easily accessed services? So taking advantage of the telehealth, taking advantage of what we've learned through COVID. And most importantly, how do we address some of those social determinants of health? Because the reality is, if someone doesn't have housing or food on their table, they're not going to be concentrated or focused on PrEP, right? So we need to make sure that we're holistically looking at the entire person. So how do we as partners work together to address some of those social determinants of health to get individuals safe and get them on PrEP? And then most importantly, and I'm sure you'll hear from our partners, how do we hire individuals with lived experiences, those that are HIV positive, those that are on PrEP, those that have been on PEP? How do we get those with lived experiences to be part of serving the community? Because again, we want to be served by those individuals that look like us and understand where we're coming from, right? So these are the call of actions that we at the federal level have been pushing out. And again, we're working through our different sister HHS agencies to support the work you're doing to enhance this, these different activities to be able to address inequalities. And then what I want to do is just play a video or two. I hope I have time here. So I'm going to play 2 videos today. So let me share my screen so you get a little flavor of what those videos look like.
I don't think who we are is a choice by any means. I think the choice is to be happy and to live in your authenticity, right? Being a Black woman of trans experience, I feel like I was just beating so many odds. So with all the health challenges that we trans people are facing, why wouldn't we want to take off one of those challenges and be on PrEP? So PrEP has given me liberation because I have to protect me and my own health. I'm Tony, I take PrEP, and I'm ready.
And then I'll play one in Spanish.
Soy nacido y criado en Puerto Rico. Culturalmente tenemos que lidiar mucho con esta idea de la internalización de ese estigma por mi sexualidad. PrEP logra romper con esas barreras y decir, podemos proteger nuestros cuerpos, podemos proteger a nuestros compañeros sexuales y también podemos acabar la epidemia del VIH. Nosotros podemos cambiar la narrativa. Mi nombre es Damián, yo tomo PrEP y estoy listo para prevenir el VIH.
And I think that's it for me. So again, unfortunately, I can't join the entire webinar, but here is my contact information. We're always happy to work with your organization to identify ways we can scale up PrEP among those communities more impacted. So Elena, other than that, I'll pass it over to you now. Thank you.
Thank you so much, Michelle. We did get a couple questions for you in the Q&A box. So maybe we can just take a few moments to address those now, if that's okay with you, Michelle. So one question, this is a question that comes up not infrequently. The question is, at a public health level, have we seen any downsides or unintended consequences to PrEP? So for example, increases in unprotected sexual activity, increases in other types of STIs. Do you have any comments on that question, Michelle?
Unfortunately, the answer is yes, but I think my partners here on the panel will be able to answer that better than me since they're seeing the community more than I am. But when we look at the data and we talk to our partners, that's what in the beginning I mentioned, utilizing our entire prevention toolbox, right? Because PrEP is not going to protect you from other STIs. So absolutely, we've seen it, but I know that that's what we're trying to push out. We've released the national STI plan last December, and it really highlights the need to encourage individuals on PrEP, but also using those other prevention tools. But I will leave that to my colleagues once they present to talk more about that.
Thank you, Michelle. We also had a question about income limitations in terms of qualification for Ready, Set, PrEP. Can you say a little bit more about any income limitations for qualification?
There are no income limitations. As I mentioned, the only 3 qualifications are you have to have a negative HIV test, no insurance coverage, and you have to have a prescription. Those are the only requirements. And you don't have to show proof of residency, Social Security, where you live, or income. So that's what makes this program very exciting, especially for those communities that don't have some of those information.
Okay, wonderful. Well, thank you so much again, Michelle. Really appreciate you taking the time to share those great updates with us. We have a few questions from folks who would love access to those videos, and I'll be sure to send out both, the slides that Michelle shared and the links after the session. So you will definitely have access to those videos later. I also wanted to remind folks that you're welcome to continue to share any questions throughout the session in the Q&A box. So feel free to share your questions for our panelists at any time. Now I'd like to pass it over to our next panelist. Our next panelist is Reyna Hernandez, who is the Associate Director of PrEP and HIV Positive Services for the San Francisco AIDS Foundation. Good morning, Reyna.
Good morning. All right, let's see. Okay, we all good? Y'all can hear me, y'all can see me?
Yes, looks great.
Thank you so much for having me. My name is Reyna Hernandez, and I'm currently the Associate Director of PrEP and HIV Positive Services with the San Francisco AIDS Foundation. Today, I'll just briefly be discussing our PrEP program located at our Magnet Clinic, talk a little bit about our other sites, and then just review our recruitment and retention strategies and some challenges that we've experienced kind of pre and post COVID. Again, thanks so much for having me. Everybody in the chat looks amazing. So just very briefly in this presentation, again, I'll just talk a little bit about SFAF's vision and work, our Magnet PrEP program, our retention and recruitment strategies for our PrEP program in sexual health services, and some of those challenges that we've experienced. Just a little bit of San Francisco AIDS Foundation. San Francisco AIDS Foundation envisions a future where health justice is achieved for all people living with or at risk for HIV. Ultimately, San Francisco AIDS Foundation strives for a day when race and gender are not a barrier to health and wellness, substance use is not stigmatized, and HIV status does not determine the quality of one's life, and where HIV transmission is eliminated. We're able to do this by promoting our mission through health and wellness and social justice for communities who are most impacted by HIV, through sexual health and substance use services, advocacy, and community partnerships. And a really big part of, again, those sexual health services is our PrEP program and sexual health services in the Magnet Clinic. Each year we see about 25,000 people across all of our services. We provide sexual health services, substance use and behavioral health services, assistance for long-term HIV survivors, and then most recently, COVID-19 response through contact tracing and partnerships with the Department of Public Health to kind of address what's going on with COVID in our communities. So our PrEP program overview. Our PrEP program started in November 2014, so pretty early on when PrEP came out. We are a nurse-led clinic, and all of our services are free of cost, regardless of a person's insurance and or ability to pay. That being said, people are able to make donations, but it is not required whatsoever and does not impact the quality of somebody's care or access to care. We're able to see most people who are privately insured, people who are publicly insured as well. And then we absolutely see a lot of uninsured clients. About 33% of our clients are uninsured. A vast majority of those folks are undocumented immigrants who are also really able to serve with our language capacity across sites and staff, and just our cultural competency due to hiring people from those communities. Our appointments as of right now and services are Tuesday through Saturday from 10 a.m. to 8 p.m. And our PrEP services are offered at Magnet at Strut, which is located at 470 Castro Street in the heart of the Castro district of San Francisco. We also have our harm reduction center on 6th Street and our downtown headquarters site at 1035 Market Street, as well as our mobile testing unit, which is currently on hold, but the idea is to be able to provide PrEP starts as well as entry to HIV care through different parts of San Francisco and Oakland on that testing site. And due to our testing technology, we are able to start people on PrEP the same day that they come in. There is no 3 to 5 wait time period where we send out the kidney check or anything like that. So our PrEP program is a one-stop shop model, meaning we have kind of everything in the same location. You don't have to bounce around through multiple facilities, and it can all essentially be done in one day. Folks, we have our PrEP Navigators, PrEP Benefit Navigators, who are all HIV test counselors. They're also all ADAP and PrEP app enrollment workers. We are all pretty well versed in the different pharmaceutical patient assistance programs, as well as covered California enrollment workers. So we are able to assist people in enrolling into full scope health insurance if that's something that they're interested in. And then the HIV specialist, that was for the medical providers, my bad. And so we have our medical providers who are all HIV specialists, they're nurse practitioners and registered nurses. Again, we do work under the license of a doctor, but all of the work that is done from testing, treating, diagnosing, and linking folks to care, it's all done under our nurse practitioners. Our medication for clients, we're able to get through their insurance through pharmaceutical programs like the Gilead Advancing Access Program, as well as Ready Set PrEP. And then also due to starter packs that we get from donations from Gilead. We are also able to assist folks with getting connected to non-clinical referrals. So it's resources that aren't necessarily PrEP specific, but as Michelle was saying earlier, absolutely assist folks in being able to remain adherent to their medication. So we have on-site as well as off-site social support groups, the substance use services that I had mentioned earlier. We also have a really great partnership with some of the different legal clinics in the area, like Oasis and LGBT Asylum Project, to really assist, especially our undocumented clients coming in, looking for legal resources as well as their PrEP care. And so we have clinic, we have clinic, and sometimes we have the LGBT Asylum Project or legal clinics come in, or we also refer folks over to them as well. Because of COVID and our limited capacity, we had to stop having guests over, but we have been referring people nonetheless. And then we also refer folks to different food programs, right? Food insecurity is very real. And if somebody's ability to have access to healthy, nutritious meals is negatively impacted, again, the likelihood of them being able to stay on their medication is not very great. So we provide those kinds of services as well. This is what our PrEP enrollment flow looks like. So again, clients either refer themselves, they find out about us through word of mouth the majority of the time, also find us on the internet. Internally, folks are often referred if somebody has multiple, positive STI tests, syphilis tests, or somebody just seems like a good candidate due to the ways that they respond to their sexual health questionnaires. Staff internally also refer them to the PrEP program. And then external referrals. We have a lot of PrEP navigators across the city of San Francisco and in Oakland who have PrEP navigators who can assist folks in getting enrolled into different programs or teach them about PrEP, answer their questions, but they don't have clinical capacity. And so we have a lot of agreements with external agencies where they will connect folks to us kind of immediately to get them started if that's something that they're interested in. So the first part of somebody's visit is they have their labs drawn. Again, they're provided with full scope STI testing for gonorrhea, chlamydia, syphilis. They also do HIV and HCV testing and a kidney check, right? And the kidney check is the one that we're able to get same day, which is what really allows us to facilitate PrEP start in the same day. After having seen a lab tech, clients are then seen by a nurse practitioner for the medical assessment, consent, and PrEP education, and to kind of answer any clinical questions and discuss any side effects during that PrEP evaluation. Once a client is done with the clinician, then they finally meet with the benefit navigator to assess benefits, to enroll them into insurance or different patient assistance programs like Ready, Set, PrEP or Advancing Access. We select pharmacies with clients, schedule follow-ups, and then kind of review, we're going to see you every 3 months, just quarterly, and that would be kind of the way that we see you in any PrEP program, and just answer any follow-up questions for clients. Again, these visits take about 90 minutes. When COVID hit, they went down to like 25, 30, and so we're trying to stick to that 30 to kind of be able to see more folks and increase capacity overall. Some of the recruitment and retention strategies. So we perform pharmacy follow-up calls for all of our clients who have who start PrEP with us. 3 days after we send a prescription, when we first see a client, we call the pharmacy to confirm whether or not a client's been able to pick up their medication. We follow up with the pharmacy, the client, and the insurance for about 30 days thereafter, or until the whatever issue that is preventing a client to access their medication is resolved. The majority of the time, there is no issue, but in those instances where there is an issue, again, we kind of deal with the issue until it's resolved. Because again, if a client wants to start PrEP, we believe that there should be no barrier, especially if we've kind of taken care of everything from the labs, the visits, the payment. And sometimes, again, it's a lot of pharmacy education as well. Something that a client can't necessarily perform or doesn't have the language to. We also re-enroll clients into the different patient assistance programs. And I highlight this because in some instances I've seen where that re-enrollment or like the initiation of re-enrollment is put on the clients. Historically, we've seen that does not work. Clients are not going to remember when their assistance program expires, or it's going to be not necessarily a priority. So we've integrated kind of following up with clients 2 to 3 weeks before their enrollment into their program, those programs expire, to reach out a few times, like 5 to 6 times, until we get contact with them and are able to re-enroll with them. We also have English, Spanish language capacity. Just across the board, we've been able to hire a lot of folks who are bilingual. And that has really allowed for a lot of our Spanish speaking folks to express, hey, I was in a PrEP program somewhere else and nobody spoke Spanish. So I just kind of felt lost and I would just drop off. But here I feel like if I call, somebody who speaks Spanish can assist me. I feel comfortable, I feel seen. I don't feel kind of like, just the random Spanish speaking person in the clinic. And so a lot of folks have expressed, I'm still here because, y'all are able to assist me in the language that I speak. We also developed the in and out follow-up model, our express model for PrEP follow-ups, whereas before clients had to come in and have like a 30 to 40 minute follow-up visit with the provider. We kind of saw that there wasn't much taking place in those visits. It was just kind of really a quick check-in. And so what we did is we kind of took out the nurse from that equation and used kind of like more like a Kaiser model, or a model where where a provider will send you to a lab to get your labs done. So people could just come in and have their labs drawn within 10 to 15 minutes and just head on out. And they don't need to see a nurse practitioner unless, they're symptomatic, they need treatment, or they have some questions. But a lot of our clients are expressing, hey, I'm not really interested in the program anymore because these appointments are kind of long. I don't have that much time. But with this express in and out model, folks are really able to be like, okay, I can come in and out. It shouldn't be any issue. And that also created more capacity so our nurses could assist folks with other things like PrEP enrollments, or PEPs or rapids, etc. We've also most recently started utilizing at-home testing, right? With COVID, a lot of folks expressed with the shelter-in-place order, we're not leaving our home. But if there's at-home testing available, we're more than open to have that. We didn't have that at the very beginning, but most recently in the last month, we started piloting it. And so we're just trying to kind of come up with best practices and see how we're best able to integrate it into our services. And for our trans clients, we started providing trans health services about a year ago, and that included hormone level checks as well as prescribing hormones. At this time, we're not able to do assessments for different letters that folks may need around different gender affirming procedures they may want, but we're in the process of starting that so that, again, we can fully serve our trans clients and they don't just have to come here for a PrEP and then go somewhere else for trans care where they don't necessarily do PrEP. We want folks to be able to receive everything that they need kind of in one spot. We also started Cutie Talk at Strut, I want to say about 2 years ago, and that stands for Queer and Trans People of Color at Strut. Again, Strut is a health and wellness center that the clinic is based in. And so what we did is essentially just kind of create like an event space on one of our floors while we were running clinic downstairs. And in that way, kind of bringing folks in for community building, social support. And if folks are interested in starting PrEP, maybe accessing PEP or other sexual health services, it was just kind of already there. And we reserved appointments specifically for priority communities. Again, the folks who are most impacted by HIV right now are not the folks who are utilizing PrEP for many different systemic and structural barriers and racism. And so we're really trying to kind of really show folks, look, we have a space for you, by you. We hired diverse staff across the board, again, because what we don't want is for clients to feel like they're being tokenized, which is something that's very often done and seen in different programs. And then we've also been able to integrate social support and behavioral health interventions, again, in particular for folks who are recently diagnosed with HIV or folks who are using different substances like meth or cocaine or drinking alcohol. Some of the challenges to all that work that we have been doing was obviously COVID, right? With COVID, we really had to decrease the amount of appointments that were available, our staffing. We also had to decrease it just so that we could stagger in case anybody, got COVID. Again, the general issue that we were seeing are the racial disparities in PrEP uptake. Our numbers were looking a lot better. Our clientele was looking a lot better, but with COVID, that kind of just slowed everything down, really halted everything. Although we did keep seeing folks for different things like STI treatment and screenings. Another big issue that has come up recently was the introduction of generic Truvada, in particular after the 6-month exclusivity that the Teva manufacturing had. A lot of folks who were on Descovy, for example, were then pushed onto generic Truvada because that's the cheaper option. And unless your plan is based in California, SB 159 does not protect your choice. You're only able to utilize Descovy if you're clinically indicated, meaning you have some kind of intolerance to Truvada. And so that's kind of been an issue because some folks just really want Descovy. And if they don't get that, they're like, you know what, I'd rather not be on this. So that's something that we're still trying to figure out how to address. And then also the copay assistance that existed for both brand and generic Truvada ended just across the board on April 1st. And so we've seen the majority of our clients have their copays completely, like they don't have copays for their medication. And that's because their insurance is in alignment with a grade A recommendation for PrEP, where clients should not be responsible for any cost sharing for the medication, but there are still quite a handful of folks who do have copays, and getting onto PrEP app is a very different process than issuing a copay card, where one takes like 5 seconds and PrEP app can take, you know, a week or two, depending on how quickly somebody can get their documents together. But that has proven to be an issue. We have been able to stay ahead of it, but clients do express like, I don't really enjoy doing this. Do I want to be a part of this? But we're trying to teach them and talk to them, be like, hey, you only have to do this once a year, et cetera, et cetera. And then stigma, right? There's a lot of stigma around sex, Truvada use, PrEP use, as well as just HIV in general. And so again, just trying to address that through education, through providing resources, and through kind of normalizing all of these things that often for a lot of folks are seen as, you know, as bad or as like shameful, et cetera. So those are just kind of the, you know, the things that we've seen. If y'all have any questions, y'all can email me or send any in the chat. But yeah, thank you. Let me see if I see any.
Wonderful. Thank you so much, Reyna. We are getting some fantastic questions in both the Q&A box and the chat. I'll do my best to capture questions from both places, but please do use the Q&A box to share your questions if you can. We will get to as many questions as we can during the session today, and then we'll be sure to follow up on any questions we can't get to after the session. So thanks again, Reyna. And now I'll turn it over to Terry Smith, Director of Sexual Health and HIV Prevention Services, and Sergio Velasquez, Biomedical Prevention Manager with APLA Health. Welcome.
Thank you. Good morning, everyone. It's a pleasure to be here, and we appreciate the opportunity to talk a little bit about the work that we're doing at APLA. So as background, as many of you may know or may not know, APLA has been in existence since 1984, and I'm very, I don't find it ironic or kind of weird that we're having this conversation and we just passed the 40th year anniversary of the first AIDS case, right? And we realize that PrEP is a really important part of how we're going to end this epidemic. And so here at APLA, our mission is to achieve healthcare equity and promote well-being for the LGBT and other underserved communities and people living with and affected by HIV. Next slide. And so we provide a wide range of services, healthcare services, primary dental and behavioral health, insurance enrollment, pharmacies, transgender health services. Prevention and health promotion are an important part of how we are addressing the epidemic as well, through various programs that are listed there. These programs all target the communities that have been most impacted by HIV. HIV support services, these are for people living with HIV. And as we kind of talk about PrEP and addressing folks who are HIV negative, we need to remember that we have a population of people who are living with HIV, many of them long-term survivors of HIV, and so it's important that we provide services for them. And so we provide medical care, housing support services, care coordination, as well as our Assessors of Life program, making sure that people have food and support. And then research and education. So we do a lot of community-based research, looking at how we can decrease barriers, how we address stigma, how we make sure that people have access to services. And then something that we recently started is fentanyl education, making sure that we're getting fentanyl strips out into the community. And all of this is really our way of really ending the epidemic, serving our community. And next slide. And so now I'm going to turn over to Sergio. For those of you in LA, Sergio is the new Sarah. Now, if you didn't know Sarah means something to you, then that's not a big deal. But Sergio has been with us for about 3 or 4 weeks now, and I'm throwing him out here to show his stuff off, and I'm very pleased that he is here. So Sergio, please talk about PrEP Express.
Thank you, Terry, for that. Hi, everyone. My name is Sergio Velasquez. Pronouns he, him, and in Spanish, I use él. And like Terry said, I have been here for about 4 weeks. I'm actually just 2 days shy of a full month at APLA Health as the new biomedical prevention manager. So I'd like to take some time to just talk about our PrEP Express programs. PrEP Express is what we use for PrEP navigation at APLA Health. And it is currently funded through 2 main grants. So from the state of California, the Office of AIDS PrEP Navigation Grant, and then from the County of Los Angeles through the Department of HIV and STD Programs PrEP Navigation Grant. And as you can see in this slide, there are specific programs that are eligible for everyone who is a California resident, regardless of where they live. And then there's a couple that are available only to someone who is a Los Angeles County resident, specifically the DHSP PEP coverage, which will cover all medical services for someone who is looking to get on post-exposure prophylaxis. So the PrEP Express team consists currently of 3 PrEP navigators, 1 for each PrEP Express clinical site, who all report to the biomedical prevention manager. So as the biomedical prevention manager, my responsibilities include supervision of the team and providing support of the team whenever it's necessary. I also manage the program's administrative tasks, so reporting, data quality assurance, all the fun stuff. I also determine who is currently actively on PrEP, and I assist with unique or challenging patient situations, which I haven't had any yet, but I'm told is usually when a patient gets an invoice for something they shouldn't have been billed for. The PrEP navigators, their responsibilities are to conduct the day-to-day PrEP navigation at their assigned clinic. So each PrEP navigator is stationed at just 1 clinic, and that's their entire responsibility. They determine the degree of PrEP navigation support for each new patient. This is also determined by their health literacy score, which I'll get into a little bit later. They complete necessary program screenings, enrollment, follow-ups, everything that PrEP navigation itself entails. And they coordinate with peer health educators, PHEs, who will conduct PrEP outreach, which is something that's very new that we're going to begin implementing. So as of this month, our PrEP Express sites include the Glycogen Health Center, the GCHC, which is right next door to our offices here at the Education Center, where our prevention and sexual health programs are housed. The Long Beach Health Center, which is on the campus of St. Mary Medical Center. And then APLA Health Olympic in the Fairfax District of Los Angeles. And so like I mentioned previously, each site has its own PrEP navigator. So for GCHC, it's Alexis. For Long Beach Health Center, we have Carlos, and then we currently have a vacancy for Olympic Health Center, and I have a couple of interviews coming up today to fill that position, hopefully. PrEP Express program activities. So here's a very general list of things that we do and don't do. So just to keep it simple, what we do, anything that involves PrEP education and navigation. So PrEP and PEP education, health literacy screening, which is to make sure that our patients, get the support that they need, depending on how much care they've experienced, or how much they understand about their healthcare. PrEP and PEP assistance program enrollment, Medi-Cal primary care provider changes, scheduling and rescheduling their follow-up appointments with their providers. And then for anyone who needs it, they offer discontinuation counseling. Things that we don't do, in general, anything that the medical team should be taking care of. So that would be reviewing labs, giving medical advice, discussing any other health concern with the patient, telling providers when to prescribe medication, correcting ICD-10 codes, and performing prior authorizations. PrEP navigation with PrEP Express starts, of course, with a screening. So when a patient comes in and they express an interest in getting on PrEP, they will talk to a navigator who will then educate them on PrEP. They will conduct a risk assessment to determine HIV risk, and again, a health literacy screening to determine the client's level, the need level of navigation services. After that, should the patient decide they want to enroll in PrEP Express and PrEP navigation, we will go into the actual PrEP navigation responsibilities, which includes educating the client on assistance programs as necessary, conducting necessary follow-ups, including risk assessments every 6 months, and providing an appropriate level of navigation services, again, based on their health literacy. After some time, we see that maybe some patients will require PrEP discontinuation counseling. This could be due to a variety of reasons. Mainly, it's either the patient decides they no longer need PrEP, they're no longer at risk, or, which is a more rare case, is that they seroconverted. So for that is we assess the client's need for PrEP discontinuation. And then again, depending on which case they fall into, we can provide education on strategies to remain HIV negative after PrEP or link the client to HIV care if necessary. What does adherence support look like for our navigators? So our navigators are responsible for following up to ensure that the patient was able to pick up their prescription. I mean, that's just the first step of making sure that a patient is adherent to medication, is that they have the medication to begin with. This can involve communicating with the provider. So if the patient was not prescribed PrEP, the navigator can look into the medical record and see that this was the case, and then communicate with the provider to ask why or why not. Sometimes it's, the patient decided after conversation with the provider that PrEP wasn't right for them, or sometimes the provider just didn't put the prescription in. And so following up to make sure that that prescription gets put in is step one. This also includes advocating to various pharmacies and with insurance providers to make sure that the patient can go and pick up their prescription and doesn't have to pay for their prescription. After that, the navigators can also provide continued support to facilitate the patient's retention in PrEP care. So this can look like assisting in scheduling or rescheduling their follow-up appointments, submitting assistance program paperwork, anything of the sort. And they also link patients to internal and external resources to address competing priorities that can become barriers to retention in PrEP care. We know from experience that if a patient is dealing with some mental health issues or needs behavioral health interventions, that those can be a barrier to PrEP and into their retention in PrEP care. And so we want to make sure that we address those, by providing the necessary support and resources so that we can ensure the patient's success in their healthcare. PrEP navigators also provide appropriate navigation support to assist patients who are not as experienced in accessing healthcare or dealing with health systems. Again, this goes back to health literacy and just, this might be the first time a patient has really had regular provider appointments, has really had experience with a medical home. We also know that, a lot of folks may have medical mistrust, and so helping break that barrier can really provide that individualized support to help our patients be retained in PrEP care. For PEP navigation, for post-exposure prophylaxis navigation, the PrEP Express team assists with starting PEP when appropriate. We currently do have, again, the DHSP PEP program, which allows the patient to be seen for PEP regardless of their insurance. This, of course, includes Kaiser Permanente. The eligibility criteria for this program are just that they be an LA County resident and that they are at or below 500% of the federal poverty level. PrEP navigators screen and educate prospective patients on PEP. So again, this involves screening to make sure that they are eligible for PEP, that they have had a possible recent exposure within 72 hours, and they're still within that window period, that they're able to get to a provider, that they're able to get their medications and provide paperwork so that if they need assistance from an assistance program, that we're able to have that coverage. The navigators work with Gilead and ViiV patient assistance program to ensure coverage for Truvada and Tivicay. The navigators can also work with other assistance programs because there are certain pharmaceutical companies that only allow a one-time access to their medication. And so we have to find alternate routes for our patients to access PEP. They will also introduce PrEP upon completion of the PEP regimen, just to make sure we bridge that gap in prevention. A little bit more about drug assistance programs. Our navigators, again, assist with PrEP and PEP submitting applications for drug assistance program depending on their eligibility. Again, for PrEP patients, this includes PrEP app and anything like Gilead. For PrEP and PEP patients, they can connect, again, to Gilead Advancing Access or ViiV Connect. Follow-ups with drug assistance programs are important for us because the more we stay on top of re-enrollments, document submission, any updates, the better prepared that our patients are in accessing their medication. We don't want our patients to, have that gap in their prevention and their PrEP care because a form wasn't submitted or, maybe their address changed and that wasn't, routed to the correct parties. The navigators can also connect patients to an eligibility specialist at their desired clinical site. And this is more so that they can have comprehensive health insurance, so that, in the future, and specifically for PrEP patients, should they want to get on PrEP, they'll have that wraparound coverage. Lastly, we have our website, PrEP Express. So this is fairly new, as I understand it, and it provides a lot of information on PrEP, PEP news, something about APLA Health, and PrEP Express. It's also available in Spanish with a lot of really good FAQs about PrEP, PEP care. Of course, this website is ever changing and evolving. We want to make sure that we give everyone the most up-to-date information on PrEP Express and PrEP Care and PEP Care in Los Angeles. We want to make sure that we're reaching as many people as possible too. So one of my goals in this new role is to add more information for the trans community and address some of the concerns that I've heard from trans patients on accessing PrEP and PEP. A really great feature about this website is that they can book an appointment to speak to a PrEP navigator directly from this website. Just going again off our future plans. So as part of my plans, again, stepping into this new role, I want to make sure that we optimize our program visibility and reach. We're currently partnering with our outreach team to implement new strategies and materials to promote PrEP Express to a wider and more diverse patient population. And I want to make sure that we are intentional about the folks that we are reaching, just because we know that there is, that the uptake for PrEP in Black and Latinx communities is not as high as in white communities. And so I want to make sure, again, that we address that. We want to make sure that we promote PrEP Express as a personalized support for all PrEP patients. So for me, this means reformulating the language to reach patients who A, may not believe PrEP is accessible to them, or B, don't feel they need help from an assistance program. One of the issues that I've seen from our navigators and that they've experienced from their patients is that folks are not enrolling in PrEP Express because they believe that all we do is enroll folks into PrEP app or enroll folks into Gilead, when that's not the case. We want to make sure that folks know that PrEP Express provides navigation support. So whatever they need, whether it's, again, advocating to their pharmacy or to their provider, answering questions or providing information, that folks really take advantage of this service. And lastly, again, we want to launch our Peer Health Educator, PHE program, to assist with program outreach. So this involves recruiting and training PHEs to conduct outreach within their communities and social sexual networks. And our aim is to reach individuals at the highest risk for HIV infection and bring biomedical prevention to them in a more accessible and personal way by using folks that they already know and trust to give them that information. I have a little bit here about our Charles Drew University campus. Terry, if you'd like to speak about that.
Sure. So sometime in late August, early September, we are going to be opening up a healthcare facility in partnership with Charles Drew University on the MLK campus. And it will include primary medical care, dental care, behavioral health, also sexual express services, PrEP, PEP, the whole thing. And this is, again, a part of our commitment to really be where the need is. And so we're very excited about that. And so I would say probably September, plans got delayed because of this thing called COVID, right? But now that we're reopened today, we are moving forward and looking forward to that being part of our portfolio of services that we're able to offer to the community.
Thank you, Terry. And lastly, I just want to leave everyone with a few numbers, just because data speaks. So in PrEP Express, we currently have 1,320 patients on PrEP. And the breakdown, just a small breakdown of this, 62.1% identify as white, 25.3% Black, and 12.6% all other races. And then by ethnicity, 67.9% non-Hispanic and 32.1% Hispanic. Again, this goes back to my point of we want to make sure that we are intentional in reaching underserved communities and folks who may not really see themselves in PrEP messaging and PrEP care in our communities. And thank you, everyone, for being here and for having us.
Wonderful. Thank you so much, Sergio and Terry. Now we'll move into a little bit of panel discussion on some of the key questions that participants submitted during registration. We also have gotten just so many amazing questions in the Q&A box. I know Reyna has been furiously responding to a bunch of them. So, participants, feel free to check the Q&A box for some of those questions and responses that are already in there. Feel free to continue adding questions. We'll get to as many as we can, and we'll be sure to follow up on any we can't get to during the session after the session. So I wanted to start with a question that came up really commonly during registration from our participants. And this was about how telehealth has been integrated into PrEP engagement and retention efforts. Of course, particularly during COVID-19, but also kind of thinking into the future, how has telehealth been used and how might telehealth continue to be used in PrEP engagement and retention? Terry, did you want to maybe comment a little bit more about how telehealth has been used at APLA?
Sure. So in response to COVID, we launched telehealth services for our primary medical care as well as for PrEP. And so the initial enrollment that people did into the program was all done by the phone, over the phone with staff. So the person really only need to come in and have their labs drawn and to see a doctor. And many people found that very supportive and really kind of appreciative of their time. And so as we're now back in the office full time, we're going to probably do a hybrid of in-person meetings as well as using telehealth, because I think it's just the wave of the future. I think it makes it much more easier and accessible for our clients.
Thank you so much, Terry. Sergio, did you want to add? Okay. Reyna, how about for SFAF? How has telehealth been integrated and how do you see it being integrated moving forward?
For us, it was essentially in the same way, right? We still needed folks to come in to have their labs drawn, but telling somebody, you're coming in for 10 minutes instead of 60 or 90 made the biggest difference, as well as telling them, we have very few staff here, everybody's wearing PPE, et cetera. And right now, what we're also moving into is providing a hybrid option, because we did a COVID access survey. We had about 800 responses, which is actually really good because normally we don't get that many. Currently, we have about 4,000 people, 3,000 people in our PrEP program. Over 1,000 dropped off during COVID, but about 3,000 kind of stayed on. We had 800 responses, and of those 800, 80% said post-COVID they would like a hybrid option to do either their labs remotely, which we can now do with the at-home testing. So you may never actually have to come back in. But for the first enrollment, absolutely, they would have to come in. But we're still trying to figure out if there's a way to just do all of that with an at-home test as well. But for sure, again, I think COVID showed us the possibilities of a lot of things, including this, which was coming up for a lot of different places. COVID just made us hurry up.
Thank you so much. So another question that came in quite frequently was about adherence and retention for folks struggling with substance use disorders. So many folks commented that adherence and retention can be especially challenging for these folks. Reyna, what are some strategies that you use at SFAF to support this population?
Yeah, so we have our substance use services that are none of them are abstinence-based. If that's something you're interested in, we can definitely support, but they're all harm reduction centered. Again, meaning folks will come in and say, I want to stop using altogether, or I would like to, use less. And so we kind of support folks across the entire spectrum, and we've seen, a lot of success as well as a lot of where folks are able to kind of meet their substance use goals as well as stay in our PrEP program and make it to their appointments, see providers, et cetera. And then on the other hand, there are still some folks that it's just a little bit difficult because it seems like they might need supportive services in a way that we don't necessarily provide with kind of like, once a week counseling or, once a month group. So yeah, a lot of folks have expressed, these groups make all the difference for me, and then other folks are just kind of like, I'm trying, but it's kind of, yeah. So we don't really have like a solve all kind of this works for everyone, but they definitely have supported some folks who are having issues around making it to their appointments, et cetera. And some of those are incentivized. Some of those groups are incentivized. We can't really say that the reason why they're adherent is because of the incentive, but we know that it's kind of what we offer, and for a lot of folks it has worked. And so for all of our clients, just every single appointment they come to, we do ask about substance use, as well as kind of like if they would like to be connected to any services, kind of how they feel about their substance use. Because the majority of our clients, I will say, check off that they use all kinds of substances, but not all of them say that they have issues with it or it's necessarily negatively impacting their use. So what I would suggest for a lot of different PrEP clinics or services is to have some kind of substance use group or counseling that's available for folks who do need it or are interested.
Thank you. Terry, did you want to comment on that as well?
I would probably just repeat what Reyna just said very eloquently about, we have a party-wise program for men who use meth, and it's harm reduction based, and just meet them where they are. And staff, identifies meth as a concern or an issue for this person, and we just meet them where they are and work with them.
Mm-hmm.
And just again, I feel like what we're saying is like, it's not so radical, it's not that huge, but for a lot of places and people it is, right? Like not judging people for their use, because folks will come in and be like, oh, I'm so stupid, I'm so terrible. And it's like, no, actually, we don't have to put any judgment or moral value to your use. And folks are like, oh, this feels kind of good. Like nobody's talked to me like this before, which I'm like, in San Francisco, seriously, but it's true. You don't go. So I think what a lot of these places have to utilize is this harm reduction approach, harm reduction / sex, drug positive approach. That's like the only way I can think of saying it.
Yeah, thank you so much for making that point. Sergio, I wonder if you can comment a little bit on this next question. Folks asked about how you track and measure PrEP initiation, adherence, and retention. So can you say a little bit more? I know you shared a little bit of data with us already, but can you say a little more about what systems you use to track those different indicators at APLA?
Yeah, of course. Thank you. Thank you for the question. So our PrEP navigators have spreadsheets that they are constantly updating that show, their individual caseload. Again, each navigator is responsible for only one clinic. And so they are responsible for tracking their caseload and every PrEP Express patient that comes into that clinic. And so they track them from beginning to end. So, from when they had their first screening call to their first appointment, even after their first appointment and prescription, they give them another call 4 days later to make sure that they picked up their prescription. And then again, based on health literacy, their follow-ups could be every 1, 3, or 6 months. And then, going on from there. And again, everything is tracked on these spreadsheets, which then get turned into me and then to our program manager at DHSP. And so we're really tracking and making sure that everyone, that needs a follow-up phone call, maybe anyone who needs, a rescheduled provider appointment, that they get that. We have access to their electronic health records. And so it's really easy for us to make sure that, if our patient had an appointment, today at 2 p.m., we can then check to see if they made it in, if they checked in, if they were able to complete their visit and what the results of that visit were. And so from there, we can also adjust our follow-ups to see, if the patient decided to talk to the provider about discontinuing PrEP, then our navigators know, okay, so now I need to make sure I reach out to this patient about discontinuation and then what that looks like for them, how to stay negative.
And I would just also add that we also report indicators on PrEP adherence and retention to our quality review committee that meets monthly.
Great, thank you so much. Reyna, how about at SFAF? Can you say a little more about the tracking systems you use?
Yeah, I'm sorry, I missed it. I was answering a question.
That's okay.
There's so many good questions. And it's to track adherence.
Yeah, so just kind of tracking adherence, well, sort of initiation, adherence, and retention, primarily. Yeah, how you kind of keep track of those indicators in particular for your clients.
Yeah, I mean, one of the big things that we do in conjunction with our service navigation staff at the front is, again, kind of like pull reports around no PrEP client should be leaving without an appointment, because if they do miss that appointment, then we're able to, pull reports based off of that kind of monthly. and check in with clients usually within 2 to 4 weeks of them missing their appointment so that we can follow up and reach out in a timely manner. But in terms of, we don't do adherence testing. I know that was a question in here. We just, again, we ask all clients during their visit, have you taken your PrEP in the last 30 days? How many doses have you missed in a week, in a month, et cetera? And then go based off of that. We have tried to figure out how to best integrate that with our new Express model of clients just coming in and out, because lab techs are not to be doing these types of counseling sessions with you. So thankfully, it's not many clients that have adherence issues, but when they do, kind of demonstrate that on their questionnaires, we are able to pull in either a nurse practitioner or another nurse to kind of discuss those things. But yeah, it's a lot of the no-show cancellation calls for clients so that we don't lose them to fall.
Great, thank you. Yeah, it sounds like both SFAF and APLA, you both have, some really good systems in place, especially for following up with clients who might be missing their appointments. So that's great to hear. I'm going to ask one more question that came up commonly during registration, and then we're going to go straight into some open Q&A because there are so many great questions still coming in. This question is about youth engagement and retention in PrEP services. So we had several folks ask about how can we make the PrEP process easier and more convenient for this population? How can we better engage youth? And youth was most of the time defined as, ages 18 to 26 or so. So kind of that transition age period. Reyna, can you comment a little bit about strategies at SFAF for engaging youth?
Yeah, so it's interesting you bring that up because we just got a youth grant, a youth PrEP grant. And so, a lot of young folks just weren't necessarily coming into our magnet clinic in the Castro. Again, historically, the majority of our clients are between like 25 to like 35. And so what we've done for a while now, but are expanding, is partnering with kind of local different youth organizations, right? Like Lyric, like Larkin Street Services. And they all kind of have PrEP navigators in their locations. So really kind of creating the best communication process as well as referral process to get clients that are going to those clinics or organizations to come to us. We've also been able to have our navigators go to those sites during their drop-in hours for youth services. Again, Lyric is not that far. It's like 2 blocks away. So even kind of stationing there and like walking clients over this way, again, providing incentives. Thankfully, since July, I think, of last year, California Department of Public Health, the PrEP program started covering PrEP 100% if you were on like your parents' insurance, because we did have that form, the My Health, My Info form that would kind of block all of your health insurance information from your parents. It's kind of weird though for your parents to be like, what is this charge? What is this bill? I can't see anything. Folks are experiencing a lot of issues with that. So we've utilized that program just kind of nonstop. Even if folks are like, I don't think I have a confidentiality concern. We're like, would your housing be impacted? Would your well-being be impacted? Would there be some kind of tension? And if the answer is yes to any of those, we're just like, okay, we're going to put you on PrEP app so that you just kind of circumvent your insurance. And that we were able to reach out to folks who were not on PrEP before that implementation came into practice. But since then, we've been able to utilize it just across the board, and it's made a big difference in keeping young folks in our program and increasing the amount of young folks who we're seeing.
Thank you. That's great to hear and exciting about your new grant.
Thanks.
Yeah, that's awesome. How about for you, Terry and Sergio, in terms of youth engagement, are there any specific strategies that you all are currently using or might be using coming up?
Yes, so Sergio had referred to this earlier during his presentation about our outreach team. So we have a couple of grants as well to specifically do outreach around PrEP. And so we actually have a youth team that will train some peer health educators and then have them go out in their sexual and social networks and then bring people back in. And there's an incentive involved. And we're referring people back in to have a conversation about PrEP. So we're not paying people to get on PrEP. I think it's really important to point out. We're really just coming to sit down and talk with the navigator and answer any questions or concerns, show people how easy it is to get on PrEP. And so that program is launching as we speak. Because again, I think COVID kind of put us back, but now we're ready to get out there full steam.
Wonderful, thank you. Okay, so we are going to move into just a flurry of questions from participants on the line with us. I'm going to start with a question that came in actually for both APLA and SFAF, which is whether you all track data specifically on seroconversions, and if so, how you use that data. So maybe we can start with Sergio on that. Do you track seroconversion data?
So not specifically, but like I said, we do make sure that we have access to each patient's electronic medical record. So as tests are run and as labs are done, that's something that our navigators will be able to see. So if a patient were to seroconvert, that's something that they would immediately know just by looking at the medical record. And from there, then our team would discuss with the provider, like, what does this look like for this patient? It means, of course, discontinuation from PrEP services, but then now linking them into HIV primary care. So short answer, no, we don't specifically track seroconversion, but we do have a way of being notified when, if and when that does happen.
Thank you. Reyna, how about for you all?
Yeah, we also don't track it, but we track it in the sense like it's documented somewhere. We do always definitely try, the first question is always like, was this person in our PrEP program? And then we just kind of go back and kind of figure out and see what happened, like what the issues were. Thankfully, it's always been like, the client was outreach to, and there were just so many other things that were in the way. We had somebody who we called you like 12 times, which I know is a lot. But for certain folks, we do kind of call anytime we get a refill request. That's going to get 3 phone calls and 2 emails, right, from the pharmacy. Or if we get like a program notification from Gilead or ViiV, et cetera, we're going to reach out again another 3 times via phone, twice via email. So for this person, very recently, we're like, we called this person like 12 times. What else could we have done besides like showing up to your home and providing that kind of service, which we don't have the capacity for at this time? And the person was like, I was experiencing unstable housing, like nonstop. I was living out of my suitcase and I was moving every week. My phone was off. I didn't have money for that. And so, for that, we were like, okay, let's figure out where in the budget we can figure out kind of like phone cards and like, temporary phones, et cetera. But again, yeah, in that way we do track it, but yeah, I guess that's tracking, right? But yeah, we do try and kind of put the dots together and be like, what could have been done differently? And unfortunately, a lot of times it's not like a clinic individual thing, it's more of a structural thing where we know that there are limited housing resources and you can't get a free phone unless you go through all of these hoops and are like super, super low income, which not a lot of our clients are not.
Yeah, no, I love that you mentioned, and I think our APLA colleagues also mentioned the importance of really assessing and responding to those kind of social and structural barriers as best you can, but to PrEP care and also to kind of HIV care in general. So thank you for mentioning that. Another question that we got was about how successful is your work with men using meth? So we know, the meth epidemic here in California is very heavily intertwined with our HIV epidemic. How successful is your work with men using meth, and is it a harm reduction approach? So Terry and Sergio, do you want to start commenting on that one?
Sure. So as we mentioned earlier, our approach for all our services are harm reduction. We meet people where they are, right? And so we do work with men who are on meth, and there are men who are on PrEP and meth, and so it is a possibility for that to happen. There are challenges and all that, and again, the navigators, along with support from the other staff, just work with people where they are in this process to make sure that if they want to be on PrEP, they're on PrEP, and they get the support to stay on PrEP.
Thank you. Reyna, you already talked a little bit about your support for folks with substance use disorders, but can you say any more specific to working with folks who use meth?
Yeah, sorry, I was actually referring to folks who use meth, since that's like a large amount of folks in our different substance use programs. And again, like Terry said, we have a lot of folks who use meth, and it's totally fine. The majority of people who use drugs don't have, aren't negatively impacted. So we do see that. But again, with those folks who are having issues with adherence, we do refer them over to one of our programs if they express being interested.
Thank you. Yeah, and I appreciate you continuing to make that distinction around, folks who use drugs versus folks, with problematic use or with use that's really affecting their life and their functionality and their ability to adhere to PrEP as well. So thank you for that. All right. We got a question in here for you, Reyna, about, can you say a little bit more about integrating social support and behavioral interventions? So I know you spoke a little bit about this during your presentation, but can you say more about the specific interventions that you use and kind of group versus individual settings?
Yeah, no, for sure. And somebody I think mentioned artists. We do use that, as well as just kind of like different configurations of it, kind of to suit clients' needs. A lot of motivational interviewing, which is very successful with our clients. And then in terms of group work, the group work, again, there are folks who are just like, I don't really want to do a one-on-one. That doesn't necessarily work for me. And it also increases our capacity. We're able to utilize the groups. Again, a lot of these are support services for trans clients who are in our PrEP program and who don't necessarily feel comfortable in, say, our substance use groups that are still primarily like made up of cis gay men who have sex with men. So yeah, that's kind of it.
Thank you. While we are on you, Reyna, I have one other question here specifically for you, which was about the Piccolo machine that you mentioned for assessing kidney health, I think it was. Can you talk a little bit more about that?
I mean, the cool thing about that machine is that we're able to get, kidney test results within about 20 minutes. And I know a lot of folks, I come from clinics where we didn't have that capacity, and folks would then have to, providers will not prescribe. A lot of times providers won't prescribe, PrEP, Truvada specifically, if they don't have access to that. I know a lot of folks are trying to get around that by just prescribing Descovy, because there should be no kidney function issue. But the issue with that is, at some point your insurance may not necessarily cover it unless you're clinically indicated for it. So again, from the beginning, we had access to the Piccolo. And so that is really when folks ask us, how are you able to do PrEP starts? It's like the HIV rapid test and the Piccolo machine. Without the Piccolo, we would likely be seeing like a 3 to 5 day wait period for clients, which doesn't even include, having to reach out to the client, which could sometimes, extend the amount of time that it takes to start.
Thank you so much. Another question we got was for everyone on the line, is anyone creating cisgender women friendly clinics? And I'd invite, other participants on the line, if this is something you're focused on, please feel free to share that in the chat. But for our panelists, Terry and Sergio, do you all have, any specific approaches for engaging cis women and or, any partners that you're working with who specifically engage with that population?
Yeah, so I mentioned earlier this grant, the marvelous grant.
Yeah.
And one of parts of that grant is actually do specific outreach to women, women of color. And so we're going to create a team. We're hiring a staff person to oversee a team of community folks who we will train, who then we will challenge to go out into their networks and talk to other women about PrEP, and then bring those women in for services.
Wonderful. That's great. Reyna, how about for you all at SFAF?
Yeah, no, for sure. One of the things that we, and everybody's kind of been saying is that like women of color are particularly impacted by HIV and could greatly benefit from PrEP use. And so across the board, we have been training all of our clinicians to, make sure that they're able to provide services to people regardless of gender. And you know, that wasn't easy because historically we are a gay men's health clinic, but we're not that anymore, unfortunately, for some folks. Again, we want to change our demographics, again, in terms of gender, in terms of race, in terms of linguistics, and that's the only way to do it. So we are on that. And again, we have updated some of our rooms to be able to do kind of full public exams and just kind of, you know, anything across the board for folks. And so, yeah, we're on that road. And that goes to, again, we're doing a lot of work to be able to provide care to trans folks, trans women, trans men, as well as cis women. So it's really good to be here at that time.
And I would just offer too that I think part of the challenge, particularly with women, is a lot of times women do not know about PrEP, or they have the misperception that PrEP is only for gay men. And so, you know, having women talk to women about that, educating and doing a more kind of active outreach, like back in the good old days, we used to go out and talk to people, I think is going to really help us provide these services to women, at least so they have the information so they can make a decision when that PrEP is right for them.
Thank you so much. Yeah, I also, I'm just going to chime in really quickly on this question as well, because I am working on a project actually with a couple of organizations here in LA, East Los Angeles Women's Center and Black Women for Wellness, who are really doing some great work around PrEP education, specifically with Black and Latina cis women. And I know that there are also, you know, fantastic partner organizations working with these populations in other counties too. But I'll share that. I'll share some contact info for those organizations after the session as well, in case folks want to follow up about some of the engagement work they're doing with Black and Latina cis women around PrEP. All right, so our next question is, how do you locate a client who falls out of care with PrEP? What steps specifically do you take to re-engage them? So I know all of you have commented a little bit on this already, but if you could just share a little bit more specifically about the steps that you take to re-engage someone once you recognize that they've fallen out of care. Reyna, can you start us off on that question?
Yeah, so again, the reports that we pull kind of show, and we can pull them based off whatever timeline we're looking at, but typically since we try to say about 2 to 4 weeks ahead, you know, we'll pull a report and see, okay, you know, today's the 15th, you know, tomorrow we'd pull who missed their appointment from the 1st of June to the 15th. We kind of get the report kind of sorted out. There's usually, depending on the time of year, honestly, there's anywhere between like 50 to 150 people who missed their appointments in that amount of time. And so we just kind of break it up between the service navigators at the front, as well as the PrEP and HIV benefit navigation team. And we call clients. The majority of clients have phones on profile. And if they don't, we will send an email, but we'll go ahead and give them a call about 3 times in the span of like a week and a half, and then also send 2 to 3 emails during that time. Usually every call is supposed to come in with an email, because even though they're both contacts, they're very different contacts. You might be better with email than with phone. And then we are pretty successful in then reaching out to folks and getting them rescheduled, right? We do try to call folks after 5, since a lot of folks do have 9-to-5 jobs, and that's also been proven to be successful. We noticed calling people at 10 a.m. was not yielding any responses. A lot of people were at work, so we were just playing phone tag. And so that's the way that we're able to identify a lot of clients. Again, that only works if you have an appointment on the schedule and you miss it. And so for those who have an appointment on the schedule and miss it, we still have refill requests that we get from the pharmacy, where the pharmacy will be like, hey, this client is interested, wants a refill. And typically if you've fallen out of care, you're not necessarily entitled one. So we try and connect them to a nurse, assess if what they need is actually PrEP. And if not, then we reach out to the client again in the same way. The reaching out is always the same, the 3 phone calls and the 2 emails in the span of like a week and a half. And then we also use program expiration reminders or withdrawals to also, again, reach out to clients. And a lot of times it's very successful. Sometimes, unfortunately, it's not. And like I said, with the most recent person, it was like they didn't have phone service and they didn't have an email on their profile. So and they had a lot of things going on. So those are kind of the three different ways. Anytime they come up on our radar and we see that they've fallen out, unless you have said, I'm discontinuing, which is very marked clearly on your profile, we continue to reach out. And if you are, Black, Latinx, trans, a young person, between the ages of like 16 to 24, we reach out for an extended period, a longer period of time, right, to prioritize.
Thank you. And we actually got a follow-up question about whether you use text messages at all as well.
SFAF currently does not. We've been trying to figure out what to do, but they're taking a while on that. But we know that that would also make a huge impact. The majority of clients say, can you text me? And right now we don't.
Thank you. Sergio, did you want to comment on that question?
Sure. So like I said, with PrEP Express through APLA Health, we have our spreadsheets that we're constantly updating. So we see every little bit of follow-up that each patient needs. And what really helps, again, is, of course, each navigator has a very specific caseload and a very specific clinic that they are looking at. So whenever we see that a patient has an appointment scheduled and they missed it, they reach out to see, hey, like what happened? Do you need some support with that? Do you want to reschedule? If there's no answer, there's of course, just constant contact efforts just to engage the client and see, maybe you just forgot about it. Maybe you had work. Just, we're trying to break down as many barriers as we can to make sure our folks are retained in PrEP care. Every so often, though, it does happen that, contact methods, like every contact effort will fail and we won't be able to get a hold of someone. So with us, we will, kind of hold off a little bit after, so many months of unsuccessful contact efforts, just because we want to be respectful of the patient and make sure that, we're not harassing them and bothering them. But we will still continue to reach out to make sure that we are able to re-engage them if that's what they want. Like Reyna said, we know when a discontinuation happens because it's very clearly marked. This patient was discontinued. We had that discontinuation counseling happen. So we know when a patient, does want to stop PrEP. And so when someone falls out of care, we know the difference between the two, and we know, maybe pay a little bit more attention to these folks who are not making it to their appointments, who have, for example, refill requests but have not come in for updated labs. Things like that. And then, of course, with if they're on patient engagement programs, making sure that we know, you've got to come in for your appointment, you've got to come in for labs, and then you've got to come in to update some of those forms. So we try everything possible to contact the patient, re-engage and retain. But it happens where every so often someone, maybe a phone's got disconnected, maybe they moved and didn't tell us. But as long as we get that confirmation that something like that happened, we'll just continue to reach out.
Thank you. So we are at 3 minutes left. I'm going to ask one more quick question, which is, can the panelists comment on client self-perception of risk for HIV? What tools do you use to assess HIV risk, and also, I think, have that conversation around risk with clients? Reyna, did you want to start us off on that?
Yeah, so we asked folks again on the registration about their sexual activity. How many partners have you had? How many of these have been condomless? Are you on PrEP, etc.? What's their status? As everybody on here knows, I'm sure nobody's like, I'm at risk for HIV because of what I do. It's just really, it's not me, it's everybody else. Which again, that's a whole other conversation around internalized stigma, etc. And so it is on the nurse practitioners as well as like whoever's doing HIV test counseling to really discuss those things with folks, right? You can have somebody come in for PrEP 3 months in a row and they're still like, I'm not at risk for HIV. And it's like, okay, well, let's talk about HIV transmission and what you're doing and what could be possible about these things. Again, not pushing PrEP onto some people that may be something they really are not interested in. But we also have found that when folks are identified around their risk, we identify that their risk, and it's like pretty like quote unquote high risk, or they are at risk for HIV, really having those conversations with folks. And sometimes it may take 2, 3, 4 times, but we have seen folks go from I'm not at risk to actually I could probably benefit from PrEP, right? And again, a lot of times people will be like, I don't want to put a pill in my body every day, but if you sometimes people just need it reflected to them. And, you know, well, if you've been taking PrEP 3 times in the last 6 months for 3 months, that's not every day, but you're putting something in your body. Also, let's talk about everything else we put in our bodies. And people are like, oh, that's true, right? And so again, a lot of it is shame. A lot of it is guilt. And so a lot of it is talking to people about these things and really exploring like what these feelings are, what their reservations are, and really being like, there's nothing wrong with taking PrEP. There's nothing wrong with being a hoe. Like a lot of us are super open about that. And yeah, so again, just talking with clients, sometimes that's all they need, but we do ask those questions and then base it off of that.
Thank you so much. Terry and Sergio, did you want to add anything?
Yeah, so this question comes up a lot, you know, especially when I'm speaking with the navigators, you know, how do you handle someone who may not believe they're at risk for HIV infection? And you know what happens just because, you know, maybe the information isn't out there, you know, maybe someone just doesn't know how HIV is transmitted, how it's acquired, anything like that. And so it really just starts, you know, step one is the education, making sure folks know, like, this is what PrEP does, this is what HIV does, this is how transmission occurs. And then, like I mentioned, you know, just coming from a very, you know, programmatic sense, we do our risk assessments every 6 months with patients. And so that way we can really see, you know, what the patient, you know, of course it is self-reported, but whatever they're telling us that they're doing, what type of sex they're having, if they're using substances, if they're using condoms, number of partners, things like that, we're able to ask and see that information. And because we're doing them every 6 months, you know, we're able to really catch if something may have changed in the patient's life. You know, just recently I was looking at data from the last month, and I noticed a lot of the patients who were talking to the providers about PrEP, they said, no, I haven't been adherent to my PrEP because, you know, we've been in quarantine and in the pandemic, and so I haven't gone out to meet anyone. And I've seen that be very common. And, you know, it doesn't mean that the patient wants to stop PrEP, or really doesn't perceive themselves as being at low risk. It's just not something that they're thinking about at the moment. And so, you know, when the time comes for their next assessment, you know, now that California is opened back up, you know, maybe that can change. And so now they do believe they're at risk. But again, you know, it really comes with having that education first and foremost. And then, of course, just having a PrEP navigator to talk to about risk and about sex and being very sex positive helps a lot, because, you know, a lot of our patients might be very intimidated to talk to their medical provider about the type of sex they're having, but they're more comfortable talking to their PrEP navigator, who is maybe closer to their age, who maybe, you know, comes from their community. And so they're able to have that more open and honest conversation with them.
Thank you so much. I wish we had another hour to talk to all of you, but thank you so much again to all of our panelists for the fantastic discussion today and for sharing all of your wisdom and insight with the group. I also wanted to thank everyone on the line this morning for your great participation and your great questions. As usual, please look out for a follow-up email from me later today with relevant information from the session and a link to the evaluation form. And I also wanted to remind everyone that the recording and slides from the session will be posted by early next week on the CHIPS website on our EHE Regional Response webpage. Thank you all again, and see you next time.
Bye, everyone.